In the country where I am from, some people act as if seeking a second opinion is a crime, but I've come to realize that seeking second opinion is neither a crime nor unethical. It is actually within the right of the patient to seek second opinion. In this series, we are going to look at two stories where people took control of their health and sought out second opinion and how it transformed their life, and also situation where people did not take the needed step by taking second opinion and how it affected their life. So the first story is about Sarah. No, these stories are not related to anybody dead or alive, but we are created for educational purposes based on what I have seen happening. Story 1: Sarah's cancer journey. Sarah, a vibrant mother of two, received devastating news after her routine checkup. She had stage 3 breast cancer. Shocked and frightened, she immediately began treatment as advised by her oncologist. However, as the side effect of the chemotherapy took their toll, Sarah felt increasingly uncertain about her prognosis. Determined to explore all options, Sarah sought a second opinion from a renowned cancer specialist. This decision proved to be life-changing. The new doctor recommended a personalized treatment plan tailored to Sarah's specific condition. With a combination of targeted therapies and innovative techniques, Sarah responded positively and her cancer went into remission. Today, Sarah is not only cancer-free, also an advocate for seeking second opinions. She credits this decision with saving her life and giving her the chance to watch her children grow. Our second story is Mark's heart condition. Mark, a fitness enthusiast in his early 30s, experienced alarming symptoms of chest pain and shortness of breath during his workouts. Concerned, he visited his primary care physician, who diagnosed him with anxiety and stress-related issues. Despite following the prescribed treatments, Mark's condition persisted and worsened over time. Determined to uncover the root cause of his condition, he sought out a second opinion from a cardiologist specializing in young doctors with heart conditions. After conducting thorough tests and evaluation, the new doctor made a startling discovery. Mark had a rare congenital heart defect that had gone undetected. With the guidance of this new medical team, Mark underwent successful corrective surgery to repair his heart defect. Thanks to the second opinion, Mark's life was saved, and he can now continue pursuing his passion for fitness with peace of mind. Now let's explore the stories of people who did not listen to what their body is telling them and decided not to seek for second opinion, and how it led to a devastating consequences. The first story is John's undiagnosed heart condition. John, a middle-aged father of two, began experiencing occasional chest discomfort and shortness of breath during physical activity. Concerned about his symptoms, he visited his family doctor, who attributed them to stress and recommended lifestyle changes. Despite following the doctor's advice, John's symptoms persisted and gradually worsened over time. He began experiencing frequent episodes of chest pain and fatigue, but he hesitated to seek a second opinion, trusting his initial diagnosis. Tragically, John's condition deteriorated rapidly and he suffered a massive heart attack at home. Paramedics rushed him to the hospital, where he underwent emergency surgery to clear a blocked artery. However, the delay in seeking a second opinion had led to irreversible damage to his heart. John's story serves as a heartbreaking reminder of the importance of seeking additional medical expertise when experiencing overwhelming symptoms, especially when initial treatment failed to provide relief. Our second story is about Maria, misdiagnosed heart failure. Maria, a vibrant woman in her 50s, began experiencing fatigue, shortness of breath, and swelling in her ankles. Concerned about her health, she consulted her primary care physician, who diagnosed her with heart failure based on her symptoms and medical history. Accepting the diagnosis, without question, Maria began treatment with medication to manage her condition. However, as time passed, she noticed no improvement in her symptoms and began to feel increasingly unwell. Despite her worsening condition, Maria hesitated to seek a medical opinion, fearing she would be seen as distrustful of her doctor's expertise. Tragically, her reluctance to advocate for herself led to a delay in receiving the correct diagnosis. It wasn't until Maria's symptoms became severe that she sought another opinion from a cardiologist. Additional tests revealed that her symptoms were not caused by heart failure, but by a rare pulmonary condition requiring specialized treatment. Although Maria eventually received the correct diagnosis and appropriate treatment, the delay in seeking a second opinion had unreversible consequences for her health. and her quality of life. So here you have it. Please do not hesitate to seek second opinion, especially when these two things are happening, when you feel that the treatment is going to have a life-changing consequences in terms of cancer, if it is going to prevent your future life, maybe affect your ability to give birth, or when you feel that the initial treatment is not relieving you and maybe the symptoms is even getting worse. So please be your own advocate and seek second opinion. It is not a crime, it is your right as a patient, but you have to learn how to do it correctly when faced with a life challenging and life changing diagnosis. Imagine receiving news that could alter the course of your life. It's overwhelming, scary, and often leaves us feeling helpless. But here is the thing, when it comes to your health, knowledge is power, and seeking a second opinion could be the key to gaining clarity and peace of mind. You could hear news like you have cancer, is a rare genetic condition, your heart isn't functioning properly. These words can scare us to our core, but before making any major decision, it is crucial to take a step back and consider all your options. Today, I went to visit Dr. Emily, and this is what she has to say. Hello, Dr. Emily. It's good to have you.
Hi, I'm Dr. Emily, a seasoned oncologist, to shed more light on the importance of seeking a second opinion. Thank you for having me. When it comes to complex medical condition, it's not uncommon for different doctors to have varying perspectives. Seeking a second opinion allows patients to gather more information, explore treatment options, alternative treatment options, and ultimately make more informed decisions about their health.
There you have it. So, what should you do if you are facing a life changing diagnosis? Here are some steps to consider. Take a deep breath. It's normal to feel overwhelmed, but try to stay calm and focus. Ask questions. Don't be afraid to seek clarification from your doctor and inquire about the possibility of a second opinion. Research. Take the time to educate yourself about your condition and potential treatment options. Seek recommendations. Reach out to trusted friends, family members, or support group for recommendation on reputable specialists. Advocate for yourself. Remember, you are your own best advocate. Don't hesitate to voice your concern and seek additional support if needed. Remember, seeking a second opinion isn't about doubting your doctor's expertise. It's about taking control of your health and exploring all available options. Your well-being is worth it. Thanks for tuning in. If you found this video helpful, don't forget to like, share, and subscribe for more empowering content. Until next time, take care and check the description to see links on support group for various health conditions. Have a wonderful day. You are not alone and you will survive this.